Okay, very good. All right, thank you. All right, I'll get to the issues of self-care, which is really related to stress. I will not go over too much about stress. I'm sure you know what that is. But the things to manage our stress are really related to how we manage or promote self-care and well-being, whether it be for ourselves or for people we work with, or for, of course, for patients and consumers that we work with. And as you know very well, stress is really where the demands of our life, whether it be work or personal life, exceeds our personal and social resources to meet those demands. And so eventually, when it gets too demanding, the stress can lead to burnout. Now, stress is not necessarily a bad thing. Stress, a lot of life events are actually stressful, but are good. Like, getting married is stressful. Like, right? Planning a wedding is stressful. Starting a new job is stressful, but that's also exciting, right? So stress is not necessarily a bad thing. But as you know very well, that stress increases really over time. As we all get into our as we all get into our professional life, more stress come in, whether it be personally or work related. So what I want to share with you is the fact that really what we need to work on is our relationship with stress. In other words, the stress will continue to increase, but how to manage it is really how we look at stress, how we work with stress instead of getting rid of it entirely. Because stress, in a way, especially at work, is unavoidable, right? We can't really avoid stress. So the way we think about stress can change the way we experience it, right? I mean, I teach at as introduced, I teach at UP, right? An example I often tell the students is, let's say there you are in the hallway, you say hi to somebody you like, they don't say hi back. Now, are you the kind of person who will let that go? Or are you the kind of person who will think about that all day? So obviously, if you're the kind of person who thinks about that all day, then that's kind of stressful, right? So the stressor itself has not changed, but our perception of it, the way we think about the stress, can change the way we experience it. So I want to share with you very quickly before I get into some tips of a study that was done several years ago. So the study I want to briefly share with you is ask this question. What they did was they followed 30,000 adults and they asked, how much stress have you experienced in the last year? And but not only that, not only did they ask that question, Doc Katie, if you can change to the next slide. They also asked if you believe that stress is harmful for your health. So again, 30,000 adults, they followed for 8 years and asked, how much stress have you experienced in the last year? But also asked, do you believe that stress is harmful for your health? And what they did 8 years later was they looked at public death records and essentially found out who died or not, right? And so if we can go to the next slide, Kate, they found that for those people who experience a high level of stress, they had a 43% chance of dying, which is, as you know very well, is very high. But that was only true if they also believed that the stress was harmful for their health, right? Because in the next slide, Doc 8, some people experience high levels of stress, but they were no more likely to die, provided they also believe that the stress was not as harmful to their health. So the message here for the study is that it's not so much the stress, but how we think about the stress that matters more, right? So Doc Katie, if you can go to the next slide. And so when you change the way you sort of think about a stressor or a particular annoying something or something you don't like, the way you think about that sort of changes the way your body's responds to it. And so when we train people to think of stress in a more positive way, their body's response adapts to it in a also more positive way. So when you're stressed out, right? Your heart, your heart rate goes up, which is why stress and hypertension, as you know, is very well linked to each other. But when you think of stress in a more positive way, you can change also your body's response to it. And so when we do that, when we train people to do that, Doc Kate, if you can go to the next slide. When we train people to think of stress in a more helpful way, it turns out people are, well, less stressed, they're more confident, right? They're more anxious. And we can see that in their physiological response, which is the next slide, Doc Kate. What does that mean? So when we train people to think of stress in a more positive way, I don't have to tell a bunch of health people what that is right in front of you, but in the very top there, right, think of that as your blood vessel. And again, right, when your stress is high, your blood vessels constrict again, which is why hypertension and stress are linked to each other, especially cardiovascular disease, because your heart should not be pumping that much. However, when we train people to think of stress in a more positive way, their blood vessels, are more relaxed, even though their heart rate might go up. So how is it possible for your heart rate to go up, but your blood vessels relax? And as it turns out, it is possible when we think of stress or when we experience things that are more positive. Like for instance, those times when when you're laughing very hard, or when something's very funny and you're having a really good time and you're laughing so hard that your sides hurt, your heart is pumping very hard, but your blood vessels remain relaxed because you're having a positive experience, even though your physiological response is where your heart rate goes up. So the message there is, the next slide, Doc Kate, is that the way you, again, think about stress matters more than the stress itself. So, which of course begs the question, Doc Kate, next slide, please, is how then do we think of stress in a more positive way, right? So stress management and self-care sort of go hand in hand, as I mentioned earlier, right? Stress management is what you do when you're stressed out, but self-care is really how to sort of prevent things from getting out of hand. But a lot of the things we do to manage our stress are also things we do for self-care. So what can we do? So next slide, please, Dr. Kate. So there are many ways you can, of course, think of stress in a more positive way. Next slide, Dr. Kate. All right. So one thing I highly recommend, I was thinking about when I was developing this slide last year, but also this year, I'm thinking about what you can do as health workers in the front lines, but also what you can recommend to your patients and consumers that are easy and more accessible. So I highly recommend to write down 3 new things that you are grateful for. Because when we do that, it reminds us it allows us to relive those moments where we can feel more motivated. For instance, I don't know, I'll give you an example. Usually we want to think of 3 grateful things we are grateful for, or things we appreciate in the last 24 hours, right? So right now I'm in Tacloban. I flew in this morning. I am grateful for a safe flight because I get nervous flying. I fly often, but I get nervous. I get anxious during flights. And so the flight was very smooth and turbulence free. So I'm grateful for that. So the way we want to do that is we want to handwrite those things, ideally not on a phone. You want to handwrite like in a journal or things that you can keep so that you can write down these 3 new things. The next slide, Dr. Kate, is to write down 1 positive experience you've had in the last 24 hours. Oftentimes we are preoccupied with the negative things, that we focus too much on them. It's okay to focus on negative things. I think that's very natural for many of us to do. But when we focus too much on the negative, we forget that good things happen, right? So right now it's almost 12:30, and I can bet you that something good already happened. And so when you write that down, when you write down the positive experience, it allows your memory to relive that moment, right? And so it allows your brain, because it's reliving that moment, it allows your brain to then feel more relaxed and less tense. Like it softens the tension both in your mind and in your body. Next slide, Doc 8. So remember, you're gonna write down 3 new things. You're gonna write down 1 positive experience. Now, this is something that you know very well that you and I should be doing more. Okay, and I'm gonna tell you why we're not exercising later on. I'm gonna give you some tips of how to exercise more or do these things that I'm sharing with you. But exercise, especially running, reduces stress, right? It increases all those good endorphins, if you will. Exercise, even 30 minutes a day, is good for everybody. Again, I'm going to talk about why some of these things are difficult to do, but for sure, exercise reduces our stress and the stress of people around us. Next slide, Doc 8. I would deliberately have fun. Now, I know this sounds silly, but a lot of the times we think of fun as like something spontaneous. And for me, especially, you know, and for you as well, like we are often so caught up in work that we forget to have fun. And so my recommendation to you is to deliberately have fun, which means that might have to be, what do we call this? Deliberately cutting time for yourself away from work to have fun, right? For me, for instance, I have a calendar. My calendar blocks off time to have fun so that I can remind myself to actually have fun, right? A lot of the times, a sign of burnout is where we cannot let go of work after work. And because of that, then it seeps into our personal life, and then we forget to have fun, right? Whatever that is. So for me, for instance, as an example, you know, I'm very passionate about my work in mental health. But mental health is not the only thing I enjoy. You know, I enjoy the arts, for instance, especially visual arts. So I went to the Pinto Art Museum in Antipolo last weekend. I deliberately did that on my day off on Sunday. And I've never been there before, so that was good. That was a positive experience for me. So again, I'm just letting you know that it's okay to be passionate about your work, and that's great. But it's okay to give yourself permission to be passionate about other things as well that are also fun and enjoyable. All right, so next slide, Doc 8, please. So part of that is to schedule pleasant events. And deliberately do them, right? You need to actually schedule those things. Now, this is a bit of an extreme example, but to illustrate what I'm trying to talk about here, during some of my clinical work, I don't do clinical work. I don't really do clinical work now. I primarily do research and policy work in mental health. But when I did a little bit of clinical work, an extreme example for some people who have severe mental health problems, such as depression or a psychotic disorder or a bipolar disorder, what I've recommended is actually for them to write down what they like to do and to put it in a small piece of paper, so that they can put it in their wallet so that they're able to carry it wherever they go. And so when it's very hard to find to do something, all they do is to pull out that piece of paper so that they can be reminded of what those pleasing things are that they can do for themselves, right? We're not talking about here a grand gesture or anything, but even those quote unquote little things that you can do that you enjoy, you can list those things down, put them in your wallet so that you can remind yourself, oh, what to do, and I can do this, okay? All right, next slide, please, Doc 8. And so eventually you can develop a wellness toolbox. Next slide, please, Doc 8. So I gave a random things here, right? You could watch Netflix, you could do some writing. I'm really into writing these days. So that could be, so this toolbox you create for yourself. and I've done this with patients and clients as well. Like you think about what simple things that you can do, including not doing some things, like not answering emails or phone calls or whatever after certain times of the day, right? So those are the things that you can make for yourselves. Next slide, please, Doc A. All right. Another is meditation. I mean, that's a whole other workshop. But meditation is known to really decrease our stress and promote mental well-being as a form of self-care. Again, I will not get into the nitty-gritty of mindfulness meditation. But one of the things that is a challenge for meditation oftentimes is that it can feel sometimes it has a what do I call this? Sort of a new agey kind of a feel. So people are a bit turned off by that. But I think that's an unfortunate misconception. I think meditation, all it is if you know how to breathe, you know how to meditate, all right? Because that's all it is. If you're breathing and sitting quietly, that's what meditation is. Meditation allows us to focus and be present in the moment, and that reduces our stress. Next, please. All right, so you've learned meditation. Kindness is another way, a tool to decrease our stress and promote self-care amongst ourselves and other people. What does this mean? I think it's wonderful that you are all very kind. I'm sure you all are. But remember, a lot of our behaviors are learned behavior, and learned behavior needs practice to be done over time. So when I'm talking about kindness here, I'm talking about something deliberate that you are doing, right? So yes, you can count on your personality as a kind person, but what I'm talking about here is to deliberately and actively do something nice and be conscientious about it. So I don't know, let's say, you're writing an email to a colleague, or you're sending a message to a patient or a client. Maybe include something that you notice that something is positive, or a coworker, you're writing an email, and you want to acknowledge them for a good job that they're doing, right? So that's a deliberate form of kindness. It reduces their stress and it reduces your stress as well. Another form of self-care, Doc Kate, next slide, is to practice. Okay, over time I've learned that, these kinds of recommendations I am giving you, that they are helpful to you, but we don't do them, right? Or they might be new to you, but you don't end up doing them because they're overwhelming, right? Especially if you're new. Like if you're a person who doesn't exercise, me recommending exercise to you is gonna feel overwhelming, all right? So the tips I'm gonna share with you here in the next few slides are how to practice, right? So next slide, please, Doc Kate. So in order to do that, we need to increase our social contact, right? So, and social support. Now, what I'm talking about here is, I'm not talking about family support or what do I call this? Friends. I mean, these are good, obviously. Having friends and supportive colleagues and having family support is good self-care, for patients and consumers we work with. But what I'm talking specifically here, I'm talking about social integration. And this means having some kind of contact, a meaningful contact with people that we encounter every day, but we don't really know personally. What does this mean? Like, for instance, when we go to work, do you say hi and good morning and how are you to the security guard, right? Do you say hi, how are you, how's your day to the cashier at the grocery store, right? Do you talk to your Grab driver? Do you talk to your Angkas driver, right? Usually we don't. A lot of the times we sort of go on with our day, sort of quote unquote ignoring them, right? Because we don't really know them very well. But social integration is known to increase our stress and to decrease our stress and decrease their stress by showing a bit of a social contact, even if we don't know them personally. Okay, next slide, please, Doc. Deep breathing is another example. I do this often. I did this in the plane earlier, on my way here. I did some deep breathing. I do it a lot when standing in line anywhere when the line is long. All right. So next slide, I think, Doc Kate, is the instruction. Yeah. You might have heard of this before. It's called the 4-7-8. It's very straightforward. You can do this anywhere. Your clients, your patients can do this anywhere. It's called the 4-7-8. You inhale through your nose for a count of 4. You hold it for a count of 7. And then you exhale through your mouth for a count of 8. And you do that. That's one breath. And you do that 3 times. I often do this. Sometimes we forget to breathe. I know that sounds silly, but most of us don't really breathe properly. And when we deep breathe, it obviously provides us with oxygen, and oxygen is very good for reducing our stress and promoting self-care and well-being. So it's called the 4-7-8. Very straightforward. Inhale for a count of 4, hold for 7, and exhale through your mouth for a count of 8. You do that 3 times. Next slide, please, Doc 8. Visualization is something a little bit more easier, actually a little bit more complicated than deep breathing. Deep breathing you can do anywhere. Visualization, you need a little bit more of a safer space because you need to close your eyes. And what it is essentially thinking about taking a few moments, maybe 4 to 5 minutes out of your day, to think of a place that you like, preferably a place that you've been to before. And something in nature is always good. Like, a beach that you've been to, a hiking trail you've been to, those kinds of things. And not just thinking about them, but when you're thinking about them, going through your senses, right? For instance, what do you see? What do you hear? What do you feel? Like if you're going hiking, for instance, what does the sun feel like against your skin? What kind of flowers you smell, or what does the green grass smell like in the mountain, right? So when you're visualizing, you're also going through each of your senses, and that as an exercise over time will decrease your stress and promote self-care. And next slide, please, Doc Kate. Okay. A lot of these things you probably will not do. So next slide, Doc Kate. I'm going to give you some tips. Okay. This is where the practicing comes in. So just very quickly, any new behavior is easier to do if you first break it down. Part of the reason why it's hard for us to do new things is because it feels overwhelming. And so my recommendation to you is whatever that new behavior is, let's say you want to go running, right? If you don't really run, first you need to break down what running is. When we break down running, we realize that running takes literally a lot of steps. You're going to put on your shoes, you're going to put on your clothes, you're going to go outside, you're going to go around the block. The first task is to break it down, because the next task, Doc Kate, next slide, please. The next task is to perfect each part before moving on, right? So the first part is you break it down, the behavior. The next part is to perfect each part before moving on. So again, going back to exercise. If you haven't been running before, running is going to be difficult. So the first part of running, based on the first part of running is to put on your shoes. So you're going to practice putting on your shoes for like maybe a week and not go anywhere, right? You're literally just going to practice putting on your running gear, but not go anywhere. And when you're comfortable, maybe next week or 2 weeks from now, you're going to go outside and come back in. And the week after that, maybe you're comfortable, you're going to go outside and go around the block. And then maybe next month, you're going to actually walk for half a kilometer. Maybe you're not going to actually run until 3 months from now. And that's okay, right? Part of our disappointment is our expectation that we're going to run on the first day. But when we practice, it's more sustainable. It takes 21 days for a behavior to become a habit. So you need to be practicing solidly for 21 days for something to be, regular for you. So the same thing with meditation. Don't meditate for 30 minutes on the first day. There's no way that's happening. So maybe you just need to sit for a minute, and maybe you're just going to sit for a minute for the entire week. And then next week will be 2 minutes. and then 3 minutes, right? You work your way up to each part. Okay, next slide, please. Prompting is where you use a clue or a cue to make it easier to do the next step, right? We do this a lot. With little children when we're teaching them new behavior. Like for instance, when you're teaching a little kid how to brush their teeth, right? On their right hand, they're holding a toothbrush, but they don't know what to do, right? A clue would be, all right, you could, as a parent, as a caregiver, you're gonna say something like, well, we need to put something white on top of the toothbrush. What do you think that is, right? You're giving them a clue. You're giving them a prompt of what to do next. And eventually they'll learn, yes, it's something called a toothpaste I need to put on top of the toothbrush. The same thing here, right? Let's say you wanna go to the gym. You're gonna pack your gym stuff the night before, put them right next to your door, so that when you go out in the morning, you're more likely to go to the gym because it prompts you to pick it up because you put it right at the door. Next slide, please, Doc 8. And you're gonna slow down rewards. A lot of our behaviors are not helpful, but cutting cold turkey is not a good idea. For instance, I don't know, if you're the kind of person who eats cookies every day, which is, probably exciting, but not good for you. If you're trying to quit a behavior, quitting cold turkey does not work. So you need to thin your way. You need to ease your way out of the behavior, all right? So again, going back to my silly example of eating a cookie every day, stopping eating cookies today is not going to work. So instead, next week, you're gonna eat your cookie as you normally would. The week after that, you're gonna eat 6 days out of the week. The week after that, 5 days out of the week. And then 4 days out. You're gonna ease your way out of that behavior, okay? And next slide, Doc 8. I think I'm almost done. Generalization is the last tip of practicing. Another reason why we are not able to adopt a new behavior, including self-care behaviors, is we feel pressured to do them everywhere. That is the mistake. Instead, practice them in one area and then do them in another area when you're comfortable. So for instance, maybe you want to do meditation. Maybe you are comfortable doing deep breathing at home. That's okay. So you're going to start at home. You're going to do your deep breathing at home. And then when you're comfortable, when you're ready, you're going to generalize. You're going to bring that practice and that new behavior to work. And you're going to do deep breathing there. Eventually, you're going to be deep breathing everywhere, right? Your home, your work, the jeepney, the bus. It doesn't matter, right? Because over time, you become comfortable and acclimated and generalize to each area of your life. Okay, Doc 8. Next slide. I think that is the last slide. Thank you very much.